this is a study where we have, again, the source images here on the left, and we have the ClearRead vessel suppressed images on the right. And I'm going to kind of scroll through this. This is a case that I came across early in our implementation. And again, it is an example of a nodule that was missed on a prior CT. The patient then had a short-term follow-up for other reasons. And at that point, we had implemented the vessel suppressed algorithm. And it just struck me as to how easy it is to miss something. So I'm just going to kind of play through this as we go along. So this is a patient, terrible emphysema we see here on the left source images. And as we're kind of scrolling along, again, if you're specifically told to look for a nodule, then great, maybe you're going to see something, but that's not always the case. In fact, a large percentage of nodules, the majority, are incidentally detected. So as we go through, and this is kind of, there we go. I want to now draw your attention to the vessel suppressed images right here. So here we have a nice large soft tissue nodule. This nodule had not really changed in size from the prior study where it was missed. And quite honestly, just scrolling through the source images, it's actually very easy to miss the soft tissue nodule. It's not small. It's embedded near the hilum. And so there's vessels as well as airways. And these more central nodules can actually be difficult to detect, regardless of how large they are. And in this particular case, this actually represented a new diagnosis of a lung cancer, originally missed. The other nice thing about the ClearRead CT component is, so we don't have just vessel suppression available to us, but if we want to quantify the size and volume of this nodule, we have those tools available to us. And so let's take a look at that. All right, so here we have the patient, same location as we previously viewed, now with the ClearRead detect algorithm applied. It gives us the average density of that area. We've got the maximal diameter that's calculated, the minimal diameter, as well as the quantified volume through that lesion. And so again, as radiologists, if you want to pull out the calipers and measure nodules all day, by all means go ahead. Just recognize that we are inconsistent and there's going to be inter-observer variability. But having an algorithm that has been trained on tens of thousands of cases to be able to do this precisely and accurately, and it's repeatable with precision, is a very valuable tool. And it's one less thing that I have to do as part of my imaging interpretation.